Madam President and members, I would urge people in this chamber to vote against House File 8. It is a bill that takes away 60% of the benefit that people in Minnesota Care have today. And that's according to the fiscal note, not according to, the math of Senator Berglin. How does this 60% reduction in benefit translate? It translates into higher deductibles and higher co-pays. Why do we have Minnesota Care for people whose employer does not provide them with insurance? Because they can't afford to pay for insurance otherwise. If they can't afford to pay for the insurance otherwise, they can't afford to pay for 60% more in co-pays and deductibles than the plan offers them today. What will this reduction in benefit translate into? It will translate into people not getting preventative care, not taking care of things in an office visit, waiting until things are bad enough that they have to be in the hospital. Even allowing a plan for people not to buy mental health or chemical dependency coverage is a dangerous step, because oftentimes we know that these are not issues that people always know about ahead of time that they're going to need the coverage for. And when they don't have mental health or chemical dependency coverage, oftentimes they end up in other state programs at state taxpayer expense. Another thing that we lose out when we talk about this approach to Minnesota Care is the idea of savings, administrative savings that are generated by pooled purchasing. Yes, Minnesota Care beneficiaries have choices about which plan they take, but the state negotiates the contract, holds down those administrative costs, requires certain quality outcomes be provided to people through the plan that they have, and all of that will be lost through this approach. So members, the Minnesota Care program is a sustainable program. It's been fairly stable throughout the time of its existence. At the moment, it has a deficit projected in the future in the account because of the very drastic things that were done to the GAMC program and really pushing many GAMC enrollees into Minnesota Care. That problem has been remedied now because we have the MA buy-in for those people. So Minnesota Care will stabilize over time. There are other ways to solve the temporary deficiency in the Healthcare Access Fund without taking these drastic steps that greatly reduce the coverage that people otherwise would have. So I urge you to vote against this bill today. Thank you.